specific supplements, backed by real science, that can help bring your cholesterol back into balance. Not hype, not gimmicks, just targeted nutrients that support your liver, calm inflammation, and nudge those LDL levels down the natural way. The tricky part? Most people don't know which ones actually work or how to take them correctly. In this video, we're breaking down the 5 most powerful supplements to support healthy cholesterol, and the real way to use them. Niacin, the HDL booster with a dual edge. Niacin might be one of the most misunderstood supplements in the world of heart health. It's been used to manage cholesterol for decades, long before statins existed, and it remains one of the few compounds proven to raise HDL cholesterol significantly. That's not marketing, that's fact. Niacin is a form of vitamin B3. In higher doses, it works directly on your liver to reduce the production of LDL cholesterol and VLDL, which eventually becomes LDL. At the same time, it boosts HDL, the good cholesterol, and can also reduce triglycerides by as much as 20 to 50%, depending on the dose and consistency. One landmark study, the Coronary Drug Project, showed that patients taking niacin had reduced rates of heart attacks and improved long-term survival, even years after they stopped taking it. And in a head-to-head comparison with other cholesterol medications, niacin was one of the only non-statin options that made a real dent in cardiovascular risk. But here's the twist. While niacin is powerful, it's not without complications. The dose that helps cholesterol is far higher than what you get from food or a basic multivitamin. We're talking 1,000 to 2,000 milligrams per day, and that requires supervision. At those doses, niacin can cause flushing, a warm, red, itchy feeling that's harmless but unpleasant. To avoid it, many people use a slow-release version, though these may carry more risk for liver stress. The safer middle ground is extended-release niacin, often taken at night with food. And yes, liver function should be monitored with blood tests, especially if you're using it long-term. Despite its quirks, niacin remains one of the most effective supplements for people with high triglycerides and low HDL, especially if they're not yet on statins or prefer a more natural approach. It's also affordable and widely available. If you're going to try niacin, don't DIY it. Talk to your doctor, start low, and go slow. A 500 milligram dose with dinner is a common starting point, and from there, you can build if needed, always with liver enzymes checked periodically. And one final tip, taking niacin with a small snack and an aspirin 30 minutes before can help reduce flushing significantly, especially during the first few weeks. It's not a trendy supplement, it's not the newest thing, but niacin has stood the test of time because it works. Berberine, the metabolic regulator. Berberine isn't just another plant extract. It's a metabolic multitasker, a natural compound that can shift your cholesterol, triglycerides, blood sugar, and inflammation all at once. And that's not an exaggeration. It's backed by serious clinical data. Found in the roots and bark of plants like barberry and golden seal, berberine has been used for centuries in traditional medicine. But in recent years, it's gained attention from researchers, especially for its effect on LDL cholesterol and blood lipids. How does it work? Berberine activates an enzyme called AMPK, often referred to as the body's metabolic master switch. When AMPK is turned on, your body becomes more efficient at using energy, burning fat, and regulating cholesterol production in the liver. This is the same pathway many diabetes and cholesterol drugs target, but berberine does it naturally. One study published in Metabolism found that taking 500 milligrams of berberine 3 times daily reduced LDL cholesterol by 25% and triglycerides by 35%, similar to the effect of low-dose statins. Another study published in Phytomedicine found that berberine outperformed a popular diabetes drug, metformin, in improving insulin sensitivity and lipid profiles. It's one of the few natural compounds that impacts both cholesterol and blood sugar with such strength. Berberine also improves LDL particle size, making cholesterol less sticky and less likely to form dangerous plaque. And it helps reduce inflammation, which plays a huge role in artery damage and cardiovascular disease. If you're thinking of adding it to your routine, the standard dosage is 500 milligrams 2 to 3 times per day with meals. That's important. Berberine is poorly absorbed on an empty stomach, but taking it with food helps increase its effectiveness. Start with a single daily dose for a few days, then gradually work up. Some people experience mild digestive discomfort at first, but this usually fades with regular use. It's also important to know that berberine interacts with certain medications, including blood sugar and blood pressure drugs, so always check with your doctor before starting it. And while berberine is powerful, it's not something to take casually. The dose, timing, and consistency matter. If you get it right, it could be one of the most valuable supplements in your heart health toolkit, especially if you're not ready for prescription meds or want extra support alongside them. With results that rival pharmaceuticals, it's no wonder researchers keep calling berberine nature's statin. Omega-3 fish oil, the triglyceride tamer. Omega-3 fish oil might just be the most recommended heart supplement on the planet, and for good reason. The research is not only extensive but remarkably consistent. Omega-3 fatty acids, especially EPA and DHA, can significantly reduce triglycerides, lower inflammation, improve HDL cholesterol, and support blood vessel health. And this isn't one of those, maybe it helps, maybe it doesn't supplements. The data is rock solid. Let's start with triglycerides. High triglycerides don't get as much attention as LDL, but they're just as dangerous, especially when paired with low HDL. Omega-3s are one of the few natural compounds that reliably lower triglycerides, often by 15 to 30% in just a few months. That's not wishful thinking. That's based on multiple randomized clinical trials, including those published in the Journal of the American Medical Association and Circulation. How do they work? Omega-3s reduce the production of triglycerides in the liver, enhance fat metabolism, and increase the clearance of triglyceride-rich particles from the bloodstream. At the same time, they raise HDL, your heart's natural cleanup crew, and improve the size and function of LDL particles, making them less likely to stick to artery walls. But the benefits go beyond cholesterol numbers. EPA and DHA have powerful anti-inflammatory effects. They help calm the silent inflammation that drives plaque formation, arterial stiffness, and heart disease. Omega-3s also help keep the lining of your blood vessels, the endothelium, smooth and functional, reducing the risk of clots and improving circulation. So what's the right dose? For general heart support, most experts recommend at least 1,000 milligrams per day of combined EPA and DHA. But if your triglycerides are high, therapeutic doses often range from 2,000 to 4,000 milligrams daily under medical supervision. Always check the label. A capsule may say 1,000 milligrams fish oil, but only contain 300 milligrams of EPA and DHA combined. You want the active omega-3s, not just the filler oil. Quality matters here. Look for a product that's third-party tested for purity, potency, and oxidation. You want a triglyceride or reesterified triglyceride form for better absorption, and ideally, a product that smells fresh, not fishy. That's a sign it hasn't oxidized. And yes, food first still applies. 2 to 3 servings of fatty fish per week, like salmon, sardines, or mackerel, gives you a strong omega-3 foundation. But if your diet's light on seafood, supplementation fills the gap efficiently and safely. Omega-3s don't work overnight, but they work powerfully over time. When taken consistently, they improve not just your cholesterol, but your entire cardiovascular landscape. They're one of the smartest, most proven investments you can make for your heart. Plant sterols and stanols, the cholesterol blockers. Plant sterols and stanols don't sound exciting. In fact, they sound a bit like something you'd read on the back of a cereal box and forget about. But when it comes to naturally lowering LDL cholesterol, they are some of the most clinically effective compounds you can add to your routine, and most people have no idea how well they work. Let's break it down. Sterols and stanols are naturally occurring compounds found in small amounts in fruits, vegetables, nuts, and seeds. They're structurally similar to cholesterol, so similar, in fact, that your body can't always tell the difference. When you consume them in higher amounts, they literally block dietary cholesterol from being absorbed in your gut. Instead of making it into your bloodstream, the cholesterol gets flushed out with waste. That's not theory, that's proven science. According to the National Cholesterol Education Program and the European Atherosclerosis Society, consuming just 2 grams per day of plant sterols or stenols can lower LDL cholesterol by 8 to 15%. And the effect is fast. Changes often show up in as little as 2 to 3 weeks. These aren't just minor improvements. For someone with borderline high cholesterol, that kind of reduction could be the difference between needing medication or not. So how do you get them? While they're found in tiny amounts in whole foods, to get a therapeutic dose, you typically need fortified products or supplements. Many margarine spreads, yogurts, and orange juices are now enriched with plant sterols. But here's the catch. You have to eat the right amount consistently. That means checking labels and making sure you're actually getting the full 2 grams per day. Supplements make this easier. A typical sterol supplement delivers 800 to 2,000 milligrams per serving, usually taken with meals, since cholesterol absorption happens when fat is present. The form doesn't matter much, tablets, soft gels, or even powdered versions. But what does matter is timing and consistency. And here's a tip. Don't take sterols with your cholesterol medication unless your doctor says it's okay. Some statins also reduce cholesterol absorption, and doubling up could lead to digestive issues or interfere with absorption of fat-soluble vitamins. Another thing to know, sterols don't lower triglycerides or raise HDL. Their main effect is specifically on LDL. That means they work best as part of a broader cholesterol-lowering strategy, one that also includes omega-3s, fiber, and lifestyle changes. So while plant sterols might not have the flashy name recognition of fish oil or niacin, their ability to block cholesterol at the gate makes them one of the smartest tools in your toolkit. Quiet, consistent, potent. Curcumin, the silent inflammation fighter. If you've heard of turmeric, you've heard of curcumin. It's the bright yellow compound that gives turmeric its color and most of its medicinal power. But what most people don't realize is that curcumin isn't just good for joint pain or digestion, it's a potent ally in the fight against high cholesterol and heart disease. The magic of curcumin lies in its anti-inflammatory properties. And we're not talking about general puffiness or a sore knee. We're talking about chronic, low-grade inflammation, the silent kind that damages your blood vessels, oxidizes LDL cholesterol, and lays the foundation for plaque buildup. This is one of the root causes of atherosclerosis, and curcumin hits it right where it starts. Multiple studies have shown that curcumin supplementation reduces C-reactive protein, CRP, a key marker of systemic inflammation and a strong predictor of cardiovascular events. One clinical trial published in Drugs in R&D found that patients taking curcumin had significant reductions in LDL and total cholesterol, especially when paired with lifestyle changes. Another study in phytotherapy research echoed these results, noting improvements in triglyceride levels and HDL, but it doesn't stop at inflammation. Curcumin also enhances the activity of enzymes that metabolize fats in the liver, helping your body process cholesterol more efficiently. It even improves endothelial function. That's the flexibility and responsiveness of your blood vessels, a critical factor in keeping arteries smooth, strong, and clear. Now, here's the caveat. Curcumin is notoriously hard to absorb. If you just eat turmeric powder with your food, you're getting a small benefit, but not enough to see real changes in your cholesterol numbers. To unlock curcumin's full potential, you need a supplement that includes piperine from black pepper, which boosts absorption by up to 2,000%. Many high-quality curcumin supplements now come in advanced forms, like phytosomes or nanoparticles, designed to enhance bioavailability. Look for these keywords on the label. The standard dose for cardiovascular support ranges from 500 to 1,000 milligrams of curcumin per day, ideally split between 2 meals. It's generally well tolerated, but some people may experience mild digestive upset at higher doses, so start low and monitor how your body responds. And while curcumin is powerful, it's not a standalone fix. Think of it as a key piece of the puzzle, one that amplifies the benefits of omega 3s, fiber, and a plant rich diet by calming the inflammation that underlies cholesterol dysfunction in the first place. It doesn't take much to make an impact. A daily capsule with the right formulation, taken consistently, can quietly improve your lipid profile over time. Because sometimes the most powerful changes in your health don't come from fighting symptoms, they come from addressing the silent forces that cause them.